Bonjour à tous, bienvenue à la conférence de presse d'aujourd'hui. Welcome everyone, welcome to today's press conference. Je passe la parole au ministre Dominique Leblanc.
Alors, merci beaucoup, Corinne. Bon après-midi, tout le monde.
Good
afternoon. Today, I'm joined by my colleague, Minister François-Philippe Champagne, and by Doctors Tam, New, and Berthiaume. Je voudrais maintenant inviter mon collègue François-Philippe Champagne à débuter la conférence de presse. Alors, à toi, François-Philippe.
Please go ahead.
Merci, Monsieur le ministre Leblanc. Bonjour
Thank you
tout le
very much,
monde.
Minister Leblanc.
Throughout the
Hello, everyone.
COVID-19 pandemic, our objectives have been clear: to protect Canadians, to provide them with safe and effective vaccines and treatments, and to ensure a strong economic recovery. With these goals in mind, we are continuing to work with our international partners to secure enough vaccines for all Canadians to receive their shot by September. And I'd like to take the opportunity to thank all the doctors that we have today, Dr. Tam, New, and Berthiaume, who have done exceptionally well to serve Canadians during these times. But equally important are our efforts to reveal vaccine manufacturing capacity here at home in Canada. And on that front, let me say a few words about some very, very good news we got this morning regarding Canadian drug developer Medicago. The company announced this morning that it has started a late-stage study of its experimental COVID-19 vaccine. The phase 3 trial is expected to involve 30,000 people in some 10 countries, including obviously Canada. This is, of course, great news for Canadians and also another demonstration of how our investments in Made in Canada vaccine development are showing concrete results for people. You will all remember that last year, our government invested $173 million to accelerate Medicago's vaccine development, to secure doses, and to complete the company's manufacturing plant in Quebec City. Which brings me, ladies and gentlemen, to share with you some more good news on the biomanufacturing front with you here today. I am pleased to announce 3 new investments as part of our domestic biomanufacturing strategy, including supporting a promising therapeutic candidate developed here in Canada. First, we're helping Novacol Pharmaceutical expand their facilities in Cambridge, Ontario, to create a high-speed fill and finish line. As you may know, fill and finish is the packaging stage of the vaccine and therapeutics manufacturing process. We know that Canada has gaps in the availability of this kind of service here in our country. So this is a key supply chain investment that we are doing to improve resilience here at home in Canada. The Novacol project will also help create 25 new highly skilled jobs while maintaining their existing workforce of about 350 employees. Le deuxième projet dans lequel nous investissons aujourd'hui a également été sélectionné
was
pour
also
accroître la
selected
capacité
to
globale de
increase our
remplissage
global
et
capacity
d'obturation
in fill and
qu'on
finish
appelle
in
communément
Canada.
le fill and finish au Canada. Nous travaillons en
We
partenariat
will be
avec les
working in
laboratoires
partnership
CABS,
with CABS Laboratories,
KABS, pour agrandir
KABS
ses
Laboratories,
installations à Saint-Hubert et aussi mettre sur
to
pied
grow
de
their
nouvelles
facilities in
installations
Saint-Hubert and
à
create
Val-des-Sources
new
au Québec.
facilities in Val-des-Sources in
Ainsi,
Quebec.
KABS pourra remplir et obturer
That way,
plus de 30
KABS labs
millions
will be
de
able to
fioles par
fill
an à
and
Saint-Hubert
finish
et
more than
produire des
30
thérapies à
million
base
vials per year in
d'anticorps
Saint-Hubert
à
and
Val-des-Sources.
produce
Ce
antibody
projet va
therapies
permettre de
in
maintenir
Val-des-Sources.
140
That
emplois
project will
et va permettre aussi de créer
maintain
40 nouveaux
140
emplois
existing
ici
jobs
au
and
Québec.
create 40 new jobs in the
Le
province of
troisième
Quebec.
investissement d'aujourd'hui
The
est
third
accordé à une compagnie
investment
qui
being
s'appelle
announced
Immune
today will be
Biosolutions,
granted to
qui est située
Immune
à Sherbrooke, au
Biosolutions,
Québec.
a company in Sherbrooke, in Quebec.
L'investissement va aider à
This
développer
investment
et faire
will
progresser son
develop and
candidat
move forward
thérapeutique
its therapeutic
une
candidate,
véritable
a
solution
real made in Quebec
québécoise.
solution.
De plus, L'entreprise établira une
Moreover,
capacité de
the company
biofabrication
will
à l'échelle
establish
clinique
a clinical
et mettra au
scale
point un nouveau processus
manufacturing
de
capacity
découverte accélérée.
and create a new
So in
accelerated
addition to
research
these
process.
biomanufacturing investments, I am pleased to announce $113 million for the next stage of funding to advance the Made in Canada vaccine and therapeutics projects through the National Research Council Industrial Research Assistance Program, which has been helping a lot of companies across our nation. Since the start of the pandemic, this program has provided advisory support and more than $37 million in funding to advance early stage and development research of 6 domestic vaccine candidates and 7 domestic therapeutics candidates for COVID-19. When the 13 recipients complete their current stage of work, the National Research Council will work to advance the most promising of these candidates to the next phase of clinical development. Tous les projets aujourd'hui ont été examinés et
All of
recommandés
today's
par les
projects
experts de
were
nos groupes de
reviewed and
travail
recommended
sur les
by
vaccins
the experts
et
on
les
our
produits
vaccine and
thérapeutiques.
therapeutic products
J'aimerais
working group.
profiter de l'occasion aujourd'hui
I'd like to
pour
take this
les
opportunity
remercier
to thank
pour leur
the
travail
members of our
diligent
working
et de
groups
continuer de conseiller le
for
gouvernement
their
du
hard
Canada
work
dans nos
and their
efforts.
advice to the government of Canada
Since
in
the
our
start
efforts.
of the pandemic, our government invested approximately $1 billion to advance industrial research and development in vaccines and pharmaceuticals and biomanufacturing capacity. Today's announcement is another good illustration of how we are moving forward with our domestic biomanufacturing strategy. It is a strategy which is aimed at reversing a 40-year trend by supporting short-term strategic actions with a long-term vision. Indeed, by investing in our domestic biomanufacturing capacity, we are advancing vaccines and treatments today, while at the very same time strengthening Canada's response to any future outbreaks. Ladies and gentlemen, Canada has the talent, the innovators, and the willing partners to be a global leader in this space. So let's seize the moment. Let's be ambitious, and let's together rebuild our biomanufacturing sector here in Canada. With that, Mr. Chair, I will turn over to you. Merci.
Merci beaucoup, François-Philippe. Merci pour ces excellentes
Thank you very
nouvelles.
much, François
So
Philippe,
now
for that
we'll
excellent
turn
news.
to Drs. Tam and Dr. New.
Bonjour à toutes et à tous. Over the past several weeks,
Hello, everyone.
COVID-19 activity plateaued at a high level, with national case counts now on the rise. To date, over 913,000 cases of COVID-19, including close to 22,500 deaths, have been reported across Canada. And over the past week, on average, almost 3,200 new cases and 31 deaths were reported daily. At the same time, about 2,040 people with COVID-19 were being treated in our hospitals each day, including almost 550 in critical care. To date, over 3,600 variants of concern cases have been reported across Canada, with the B.1.1.7 variant accounting for over 90% of these to date. With high infection rates and more contagious variants spreading, we must remain vigilant to prevent acceleration of the epidemic and its severe outcomes. With over 4.4 million COVID-19 vaccine doses distributed and over 3 million doses administered across Canada, federal, provincial, and territorial authorities are continuously monitoring COVID-19 vaccine safety. To date, no unexpected vaccine safety issues have been identified in Canada. Health Canada is aware of reports of serious adverse events in Europe following immunization with the AstraZeneca vaccine, but wants to reassure Canadians that the benefits of the vaccine continue to outweigh its risks. There is currently no indication that the vaccine caused the observed events. Health Canada is continuing to work with international regulators, including the European Medicines Agency to determine whether there is any need to take action in Canada. At the same time, expert advice on the optimal use of vaccines is being adapted to maximize the benefits of COVID-19 vaccines authorized for use in Canada. Today, the National Advisory Committee on Immunization has released updated recommendations on the use of the AstraZeneca vaccine, including expanding the recommendation for its use from adults aged 18 to 64 years to now also include those aged 65 years and older. As an estimated over 380 million COVID vaccine doses have been administered worldwide, the science is continuing to emerge on real-world use, providing us a greater understanding of the safety and effectiveness of these vaccines across the population. NACI continues to analyze this emerging evidence and will adapt their advice to maximize the benefits of all COVID-19 vaccines authorized for use in Canada, as we aim to protect more people faster, while maintaining the highest standards for vaccine safety and effectiveness. As we all wait our turn to join Team Vaccine, let's continue to cheer from the sidelines and help by remaining vigilant, following public health advice, and keeping up with individual practices that protect us all. Thank you.
Bonjour à toutes et à tous. Ces dernières semaines, la transmission de la
Hello
COVID-19
all.
s'est
Over the past several weeks,
stabilisée à un niveau
COVID-19 activity
élevé,
has
le
leveled off
nombre
at
de
a
cas
high
au pays
level,
étant désormais
with
en
national
hausse.
case counts now on the
Jusqu'à
rise.
présent, plus de 913
To
000
date,
cas de COVID-19,
over
dont près de
913,000
22
cases of
500 décès
COVID-19,
ont été
including close
signalés
to
au Canada.
22,500
La
deaths have
dernière
been
semaine,
reported across
près
Canada.
de 3 200
Over
nouveaux
the
cas
past week,
et
on
31
average,
décès ont
almost
été
3,200
signalés
new
en
cases and
moyenne
31
par jour.
deaths were reported
Au
daily.
cours de la même période,
At the same
environ
time,
2040 personnes
about
atteintes de la COVID-19
2,040
ont
people
été
with
traitées dans
COVID-19 were
nos
being
hôpitaux
treated in our
chaque jour,
hospitals each day,
dont presque
including almost
550 étaient
550
aux
in
soins
critical care.
intensifs. Jusqu'à présent,
To
plus
date,
de 3600
over
cas de variants
3,600
préoccupants
variant of
ont
concern
été
cases have
signalés
been
au
reported
Canada,
across
le
Canada,
variant B117
with the
représentant à
B117
ce jour
variant
plus de
accounting for over
90% de
90%
ces
of
cas.
these to date.
Compte tenu des taux d'infection
With
élevés
high
et
infection
de la
rates
propagation
and more
des variants
contagious
plus
variants
contagieux,
spreading,
nous devons rester
we must
vigilants
remain vigilant
pour éviter une
to prevent
recrudescence de
acceleration of the
l'épidémie et
epidemic
des cas
and
graves.
its severe outcomes.
Avec plus de 4,4 millions de doses distribuées
With more
et
than
3 millions
4.4
de doses qui
million
ont été
doses
déjà
distributed
été
and over
administrées au
3 million
Canada,
doses
les
administered
autorités
across Canada,
fédérales, provinciales et territoriales
federal, provincial, and
surveillent sans
territorial
cesse
authorities are
l'innocuité des
continuously
vaccins
monitoring
contre la
COVID-19
COVID-19.
vaccine safety.
Aucun problème imprévu lié à
To date,
l'innocuité des vaccins
no
n'a été
unexpected
soulevé
vaccine
à ce
safety
jour
issues
au
have been
Canada.
identified in Canada.
Santé Canada est au courant
Health
des
Canada is aware
déclarations
of
des réactions
reports of serious
indésirables
adverse
graves survenues
events
en
in
Europe à la
Europe
suite de
following immunization
l'immunisation
with
par
the
le vaccin contre la
AstraZeneca
COVID-19
COVID-19 vaccine.
d'AstraZeneca. Toutefois, le
But
ministère
the
tient à
department wants
rassurer
to
les Canadiens
reassure
que les
Canadians that the
avantages du
benefits
vaccin
of the vaccine
continuent de
continue to
l'emporter sur
outweigh
ces
its
risques.
risks.
Pour le moment, rien
There
n'indique que
is
le
currently
vaccin a
no
causé les
indication that the
réactions
vaccine caused
observées.
the observed
Santé
events.
Canada continue de collaborer
Health
avec
Canada
les
is
organismes
continuing
de
to work with
réglementation
international regulators,
internationaux, notamment avec
including
l'Agence
the European
européenne des
Medicines
médicaments,
Agency,
pour déterminer
to
s'il y a
determine
lieu
whether there is
d'intervenir
any
au
need to
Canada.
take action in Canada.
Parallèlement, les avis
At
techniques
the
sur
same time,
l'utilisation
expert
optimale des
advice
vaccins
on the
sont
optimal use of
adaptés pour
vaccines is being
maximiser les
adapted
avantages des
to
vaccins
maximize the
contre la
benefits
COVID-19
of COVID-19
autorisés au
vaccines
Canada.
authorized for use in Canada.
Aujourd'hui, le Comité consultatif national de
Today,
l'immunisation,
Canada's
ou
National Advisory
CCNI,
Committee
du
on
Canada,
Immunization, or
publie des
NACI,
recommandations
has released
actualisées sur
updated
l'utilisation
recommendations
du
on the
vaccin
use of the
AstraZeneca,
AstraZeneca vaccine,
notamment l'élargissement de la
including
fourchette d'âge
expanding the
recommandée
recommendation
pour
for its use from
l'utilisation
adults
chez les
aged
adultes de
18 to
18
64
à
years
64 ans pour
to now
inclure
also include
dorénavant les
those
personnes
aged
âgées de
65
65
years
ans
and
et
older.
plus. Nous estimons que plus de 380 millions de doses de
As an
vaccins
estimated, over
contre la COVID-19
380
ont
million
été
COVID-19
administrés
vaccine
dans le
doses
monde.
have been administered
La science
worldwide.
continue
The
d'approfondir son
science is
savoir sur
continuing to emerge
l'utilisation
on
réelle,
real-world
ce qui
use,
nous permet de mieux comprendre
providing us a greater
l'innocuité et
understanding of the
l'efficacité
safety and
des
effectiveness of
vaccins
COVID-19
contre la
vaccines across
COVID-19
the
dans la
population.
population. Le CCNI continue
NACI
d'analyser
continues
ces
to
nouvelles
analyze
données
this emerging
et
evidence
après ses avis afin de
and will
maximiser
adapt
les
their advice to
avantages de
maximize
tous
the
les vaccins
benefits of all
autorisés au
COVID-19
Canada,
vaccines
car
authorized for use in
l'objectif
Canada,
est de protéger
as we aim to
davantage
protect
de
more
personnes
people
plus
faster
rapidement,
while
tout en
maintaining the
maintenant
highest
les normes les
standards
plus
for
strictes en
vaccine
matière
safety
d'innocuité
and
et
effectiveness.
d'efficacité. En attendant notre tour pour nous joindre à l'équipe
As
des
we all wait our
vaccinés,
turn to join Team
continuons de la
Vaccine,
soutenir et à faire
let's
preuve
continue
de
to cheer from
vigilance
the
en
sidelines
suivant les
and
consignes de
help by
santé
remaining
publique
vigilant,
et en appliquant les
following public
pratiques
health advice,
individuelles qui nous
and
protègent
keeping
tous.
up with individual practices
Merci.
that protect us all. Thank you.
Merci beaucoup, Dr. New. Alors, Corinne,
Thank you very
on
much,
prendra
Dr.
les
New.
questions maintenant.
And now, Corinne, we're ready for questions.
Merci. Nous allons donc passer à la période de
Thank you. We'll
questions
move
au
on to
téléphone
questions on the
avec une
telephone line
question de suivi
with
chacun.
one question and one
We will now
follow-up.
take questions on the phones with one question, one follow-up each. Opérateur, première question.
Merci. Thank you. Veuillez s'il vous plaît appuyer sur l'étoile 1 maintenant. Si vous désirez poser une question, please press star 1 at this time for any questions. Notre première question est de Raymond Fillon de TVA. À vous la parole.
Merci. Bonjour, une question pour Dr. New d'abord. Est-ce que la
Thank you very
troisième
much.
vague
I
est
have a question
commencée
for
en
Dr.
Ontario
New.
selon vous?
Has the
Plusieurs
third
experts
wave
pensent
begun
que
in
oui.
Ontario? According to you, many experts seem to think that it has.
Merci pour la question.
Answer.
Oui,
Thank you for
on
the
suit
question.
étroitement c'est quoi la situation
Yes, we are following
à l'heure actuelle en
closely the
Ontario,
situation
mais
that's happening currently in
c'est
Ontario.
sûr que les cas commencent à augmenter, mais c'est difficile
Cases
pour
have
moi et
begun
je
to
pense même
rise,
pour les experts à travers le pays, même en Ontario, pour
but it's
déclarer une
hard
troisième vague.
for me or
Des
other
fois,
experts
c'est
throughout the country or in
seulement
Ontario to
peut-être en
necessarily
rétrospective
declare a third wave.
avec la
Very
courbe
often,
épidémique si on est sur la
it's
pente
only in
descendante.
retrospect
Mais pour l'instant, c'est
that
un
we can
bon
tell
signal pour tout le monde pour faire
we're on the
attention que oui,
downhill
il faut
side of
continuer
things.
à suivre
But
les
for now,
consignes
what's
de
really
de
important is
santé
to
publique
continue to
parce que
follow public
oui,
health guidelines.
si on ne suit pas étroitement les consignes de santé
If we
publique,
don't closely
c'est
follow
sûr
public health
que
guidelines,
les cas vont continuer à
well, it's
augmenter.
clear that cases
Je
will
pense que
continue to rise.
les programmes de vaccination se déroulent bien, mais avec les
Vaccination
variants
programs are going
préoccupants,
well,
c'est vraiment
but
une
with the
préoccupation
variants of
et je pense qu'il y a
concern,
des experts partout.
well, I
Merci.
think that is something that's worrying experts everywhere.
Merci. Ma question suivie serait pour le ministre Champagne,
Follow-up
pour un
question
collègue au sujet de Medicago. Vous en avez
for
parlé en
Minister
anglais tout à
Champagne.
l'heure, le lancement de la phase 3 de l'essai clinique.
Earlier in English, you spoke about
Pouvez-vous nous expliquer ce que ça
phase 3
représente
of
comme
clinical
nouvelle?
trials at
Certains diront
Medicago. Could you
que,
tell us
compte
what
tenu
that
que ce
represents?
vaccin sera vraisemblablement pas disponible avant la fin de la vaccination
It
au Canada
sounds
contre la
like that vaccine
COVID-19,
won't be available
on peut
until the
peut-être se
end of
demander
the
pourquoi.
Canadian vaccination
Ce serait une bonne
campaign.
nouvelle, mais j'aimerais vous
So
entendre
then
là-dessus, s'il vous
one
plaît.
could ask oneself why this is good news. I'd like to
Merci,
hear from you
M.
on
Fillon.
that.
Je pense que c'est une grande
Answer.
nouvelle parce que depuis le départ,
Well,
avec les
I think this is
autorités,
great news
on essayait
because
de
from the very
développer un
beginning with
vaccin
the
au Canada. Il
authorities, we
faut
were trying
savoir
to
que
develop a made in
Medicago, qui
Canada
est à
vaccine.
Sainte-Foy, Québec,
And
est
Medicago, which is in
le
Sainte-Foy,
vaccin le
Quebec,
plus avancé au Canada.
has
Et
the
là,
most
de voir
advanced
que non
vaccine in
seulement
Canada.
Medicago avance, mais qu'il s'allie avec une grande firme pharmaceutique,
And not
GSK,
only is it progressing,
pour la
but it is
nommer. Moi, je
joined
pense que c'est une grande
a
nouvelle
big
pour le
pharmaceutical
Québec, grande
company.
nouvelle pour
And
le
this is
Canada,
great news
parce
for
que,
Quebec and
vous savez,
Canada.
on avait investi dès le départ 173 millions
From the beginning, we
pour
invested
accélérer
$173 million
justement le développement de ce vaccin-là et puis
speed
de
up the
bâtir la
development of this
capacité
vaccine
manufacturière. Et je pense qu'il y a une chose qu'on a
and
appris,
to
M.
increase
Fillon,
manufacturing
c'est que
capacity.
les Canadiens et Canadiennes
And what we've
s'attendent à ce
learned
qu'on pose
is
des
that
actions
Canadians
immédiates
expect us to
stratégiques,
take
mais avec une
immediate
vision à long
strategic
terme.
action,
Alors, peu
but with
importe
a
ce que
long-term
l'avenir
vision.
va nous réserver,
That
je
way,
pense
no matter
qu'une
what the
des
future
leçons, une des
holds,
grandes leçons de cette
I
pandémie-là,
think one of the great
c'est
lessons of
d'être
this
plus
pandemic
résilient,
is that we
de
will need to be
s'assurer
more
qu'on
resilient
ramène le plus possible chez nous les chaînes
and ensure
d'approvisionnement
that we
pour assurer la
make
santé et
supply
sécurité des
chains as
Canadiens.
local as
Alors moi, j'y vois là
possible
une
to
grande
protect
nouvelle.
Canadians' health and safety. That's why I think this is great news.
Merci. Thank you. Next question. Prochaine question.
Our next question is from Mia Rabson from the Canadian Press. Please go ahead. À vous la parole.
Yeah, Dr. Tam, I'm wondering if you could talk a little bit more about what we're seeing in terms of variants, how they're behaving. We do seem to be seeing higher percentage each day of those variants. And if we have any evidence yet of what impact they're having on severe disease, on death, but also if the vaccines are showing any impact with them. What evidence at all do we have about that at this point?
Thank you for the question. And as I said in my remarks, there's over 3,600 variants of concerns now identified in Canada. By that, what I mean is the number that have undergone the genome sequencing. There are, in fact, many more cases where we suspect that their cases are very concerned because they contain these mutations. Provinces have been screening essentially almost all of their cases for mutations. So there are many more underneath these already sequenced viruses so we know it is actually occurring in Canada. So the 3,600 is kind of a tip of the iceberg, and there are many more cases with those mutations. So that is definitely concerning. We do know that public health measures do work. We've seen that in other countries in slowing down and controlling these the spread of these variants. But they're obviously occurring at a time when the population-based immunity is quite low. I think based on our preceding serial surveys, the percentage of Canadians or people in Canada with previous exposure to the virus is low, and then our vaccines are just accelerating. It's great news, but we've got a long ways to go. So under these circumstances, when these variants are accelerating, it's a really sort of precarious time for us, which is why every level of government has to be really vigilant and concerned. Now, I think, what do we know about these variants? You've seen probably some of the studies coming out of Ontario, which suggest, of course, they're more transmissible. When we look at that reproduction number, it's over 1, it's 1.2 or more so far in the context of Ontario. And which means they have a great propensity to accelerate, to that speed of spread is going to be bigger than the previously existing variant or viruses. So that is why I think we are concerned about the variants. Secondly, based on information, particularly from the United Kingdom, the B117 variant is associated now. There's stronger evidence to show it does result in more severe outcomes. So now hospitalizations and also deaths. So I think this is why, we're watching, of course, that epidemic curve really carefully, because there is this upswing we're seeing now. And also recall that what you're seeing now is what happened a couple of weeks back. And so this is not the time to increase your contacts. You need to sort of keep that contact rate as much as you can. People do have essential things that they need to do, but as much as you can, keep that contact rate down. Otherwise, the vaccines won't have time to take effect. So that's what we know. And at the same time, I think we know a bit more about how effective the vaccines might be against these variants and against the B117 variants and others. Certainly, there seems to be good coverage on the whole for the B117 variants and lower maybe for the others. But the vaccines do still offer protection.
Thanks for that. And I'm also wondering if you could talk about the death numbers, which you talked about the number of cases sort of had flatlined for a while and were creeping up again. But in that same time period, the number of daily deaths seems to go down. What do you attribute that to? Is that vaccine? Is that luck? Is there a reason that you can explain why the deaths have gone down?
That's a really important observation, one we're watching really carefully, because obviously some of the most high-risk groups are being vaccinated as a priority. The good news is, based on reporting from the provinces, the rates in the over 80-year-olds have come down below the rates for the other age groups now. That suggests that the vaccines might have a good effect. Secondly, is that the number of long-term care facility outbreaks have reduced over time. Now, one might say, well, it's because of all the public health measures that's been put to bear. That's possible too. Reducing community transmission rate does have an impact on the rates in long-term care. But that kind of drop is really encouraging. And what we've also heard is that, the number of cases in relation to any of the long-term care outbreaks are smaller than they were before. And so those are really good signs. Now, the number of deaths and hospitalizations, as we all know, are lagging indicators from the cases. So if the cases start going up, it'll be a number of weeks before we know whether that's resulted in any increase in deaths. But I think it is encouraging that those who've been vaccinated first, that over 80 plus age group, their rates are crossing the lines of the incidence of all the other age groups, dropping below all of them. So that's really great news.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. Notre prochaine question est de Philippe Vincent Foisy de Radio-Canada. À vous la parole, please go ahead.
Oui, bonjour. Ma question pourrait être
Hello.
pour le Dr. New, puis
Question
si jamais un ministre qui veut embarquer.
For Dr. New, and if the
À
ministers
quel
want to
point
jump
est-ce que
in,
vous
that
voyez en
would be great
Europe
too.
avec la suspension du vaccin
Now,
d'AstraZeneca,
with the
ça
suspension
vous
of the
fâche parce que
AstraZeneca
vous
vaccine in
répétez
Europe,
tout va bien, mais dans la
what are your
population,
thoughts
il y a
on
de
that?
plus en plus de
You
gens qui sont
keep
inquiets de ce
saying
vaccin-là,
that
des gens
everything's
qui
okay,
refusent même de se faire
but more
vacciner
and more
avec ce
Canadians are
vaccin-là
concerned about this, or
lors
even
de la campagne de
refuse to be
vaccination.
vaccinated with
Je sais que vous
AstraZeneca.
allez me dire un vaccin, c'est mieux qu'aucun vaccin,
Now, I
mais
know that you're going
ces
to say that
gens-là,
getting
là,
any vaccine is better
qu'est-ce que
than
vous
no
leur dites pour
vaccine.
les convaincre alors qu'en
But
Europe,
what are
on
you
dit,
telling the
il y a des
people
risques, on
to
est mieux
convince
suspendre?
them when in Europe people are saying that it was a better idea to suspend
Moi,
the vaccine?
merci pour la question. Moi, je peux commencer avec une réponse, mais aussi, je
Answer.
vais céder la parole aussi
I'm
à mon
happy to
collègue,
answer this
Dr.
question, but I
Berthiaume
will
de Santé
also
Canada, parce
ask
qu'il
my
fait partie
colleague, Dr. Berthiaume
de
from
notre
Health Canada
système
to answer as
réglementaire
well,
ici au Canada.
because he's part
Ce
of our
qu'on voit
regulatory system
actuellement
here in Canada.
en Europe, d'après moi, c'est
What we're
les
seeing in Europe, in my
autorités
opinion,
ont utilisé comme dit, un excès de
is that
prudence
the authorities
pour
are
examiner, analyser
in
qu'est-ce
a
qui se
very
passait avec
precautionary
les
manner,
cas signalés
perhaps with an
avec des
excess of
événements
caution,
thromboemboliques. Mais
because they're
ce que
looking
je vois avec
into blood
les
clot
données probantes jusqu'à
situations. But
date,
when I
c'est
look
que
at the data,
vraiment le taux
when I
l'incidence
look at the data so
des
far,
événements, c'est pas
the rate
vraiment
of these types of adverse
différent
events
que de
is
comment
not
dire,
different than
l'incidence
among
attendue
the
pour la
population
population en
as a
général.
whole.
Ça, c'est un aspect. L'autre aspect aussi, c'est
That's one
ici au
aspect.
Canada,
And then the other
notre
aspect is that here in Canada,
vaccin d'AstraZeneca, à l'heure actuelle, vient de l'Inde. C'est complètement
our
une autre, comme
AstraZeneca vaccine
des
supply
autres
is
lots
coming from
qui
India.
viennent
It's from a
de
completely
notre,
separate
comme
lot.
usine en Inde. Donc,
It
c'est
comes
pas
from
la
a
même
separate
chose avec
factory in
la
India.
production, avec peut-être les lots
It isn't
qui font
produced in
partie
the
d'une
same
enquête en
location
Europe. Donc,
as the lots
ça,
that
c'est le
are
deuxième
currently
aspect.
being studied
Et
in Europe.
pour
That's
la
the second
confiance des
aspect.
Canadiens, moi,
And as for
je n'hésite
Canadians'
pas à
trust,
accepter n'importe quel vaccin
well,
si ce sera
I
mon tour
personally
et
would
on
take
offre
any of the
n'importe quel
vaccines
vaccin. Je
if it
pense
was my turn.
avec l'approbation des vaccins ici au Canada autorisés et
And I
aussi
think
avec
that when
l'expérience
it comes to
avec même
vaccines that have been
au
approved here in
Royaume-Uni
Canada,
avec
I would take
plus
any
de
of those.
11
And if we
millions
look
de
at what happened
personnes
in the UK,
vaccinées déjà,
where
je pense
11 million people
qu'on a
have
une bonne
already been
expérience et je
vaccinated,
pense que comme les bénéfices, c'est beaucoup,
I think that the experience has been very good and the
important que
benefits are
peut-être les
clearly
cas déclarés
outweighing
jusqu'à
the
date. Mais
risks.
peut-être Dr. Berthiaume peut
And I would
ajouter
ask
quelque
Dr.
chose.
Berthiaume to add.
Certainement, avec plaisir. Juste peut-être pour
Yes, with
mentionner en
pleasure.
complément que Santé Canada suit de façon rapprocher toute la
I would just
situation
say
de
that
ce qui se
Health
passe
Canada is
avec
closely following the situation.
les vaccins en Europe.
It's
Ce que je dois
closely following
dire,
the
c'est que
vaccine situation
l'Agence
in Europe.
européenne du médicament qui a approuvé le vaccin
The European
d'AstraZeneca
Medications
ne
Agency
l'a
that
pas
approved the
suspendu.
AstraZeneca
Certains
vaccine did
pays
not
ont mis leur
suspend it.
campagne de vaccination sur
Instead,
pause en attendant
some
les
countries have
conclusions de
paused their
l'Agence
vaccination
européenne du
campaign
médicament
while
qui
waiting
investigue
for the
actuellement
Medication
les effets
Agency's
indésirables
conclusions,
thromboemboliques,
which is
puis
looking
qui
into
regarde est-ce que
adverse
ça
blood
pourrait être lié au
clotting events
médicament ou pas
and
en
is looking
analysant
into whether
l'ensemble
that
des
could
cas.
be
Ce
linked
qu'on peut dire
to the
actuellement, c'est
vaccine or
que
not
le
by
taux des
looking at
cas
all
est
of the
plus bas que
cases.
ce qui serait attendu dans
However,
cette
what we
population-là,
could
juste
say is
sur
that
la
the
base des
rate
taux qu'on
of these
attend
events
des
is
effets
actually lower
indésirables,
than what
pas
we
des
would
effets
expect
indésirables, mais des événements thromboemboliques qui
what we would
arrivent de
expect for
façon
the whole
spontanée dans une
population,
population. Donc,
because there
l'analyse
will be such
préliminaire
adverse events
actuelle
that
est
will
très
occur
rassurante.
spontaneously
Je peux
within the
dire aussi que
population.
l'Agence
So
européenne du
currently, the data
médicament
is
a tenu une
reassuring.
conférence de
And what I
presse
can
ce
add is that
matin,
the European
réitéré
Medications
sa
Agency
confiance
has
dans le
held a
vaccin
press conference. It
d'AstraZeneca
held a press
et a
conference this morning
encouragé
to reiterate its confidence in the
les
AstraZeneca
différents
vaccine.
pays à continuer à
It
l'utiliser
is
dans leur
encouraging
campagne de
countries to continue
vaccination.
to use this
Il va y
vaccine in their
avoir une
campaigns.
réunion de suivi jeudi
There will
avec
be a
plus
follow-up meeting
d'informations
on Thursday
relatives à
with
l'évaluation
more
de l'Agence
information.
européenne du médicament, mais actuellement,
With more
sur la
information
base des données qu'on a
from the European
au
Medications
Canada et sur la
Agency,
base de l'évaluation que
but
l'Agence européenne
with
du
the
médicament a
information we
fait,
have so far and with the
ça
information
continue
we've gotten
d'être
from the
sûr
EMA,
et efficace d'utiliser le
we
vaccin
continue to
d'AstraZeneca.
believe that it is safe and effective to use the AstraZeneca vaccine.
En suivi,
Follow-up question.
j'entends ce que vous dites. Mais il y a
hear
des
what you're
gens
saying.
qui ont des
But
craintes sur le fait que les vaccins ont été produits très rapidement.
some
Pour le
Canadians are
fait
concerned because
qu'il y
vaccines were
a
produced very
des
quickly.
possibles effets secondaires comme on voit en Europe.
People are concerned about possible
Je comprends
side
votre
effects
l'argument
as we've
rationnel
seen
là,
in
pour
Europe.
dire faites-vous
I
vacciner, le
understand
vaccin il
your
est
rational
sécuritaire,
argument
mais
where
j'aimerais
you
ça
say
comprendre
get
toute
vaccinated,
la
the
stratégie,
vaccines are
plus c'est
safe.
quoi comment vous
But I'd
allez
like to
faire
understand
pour
more about your
convaincre ces
strategy.
gens-là
What will
qui
you
vont
do
se faire
to convince
vacciner et
people
qui décident
that
de
are
ne
getting
pas
vaccinated
finalement recevoir l'injection
that were going to
d'AstraZeneca.
get vaccinated, but that
Vous pouvez
ultimately
me le
decided
répéter à
not to
moi, là,
get
mais je
the
pense que le
AstraZeneca vaccine?
gouvernement, ce que Santé Canada, ce que l'Agence de la
It's all
santé
very well to
publique
tell me,
va faire dans les
but I'd like to
prochaines
hear what
semaines
the government
pour
and Health
convaincre
Canada
les
and
Canadiens
the
qui
Canada
ont des
Public Health
craintes.
Agency will be doing to convince
Si
Canadians.
je peux commencer, peut-être que Dr. Nou va vouloir
Answer.
compléter, mais
I'll start,
je pense que l'approche qu'on prend, c'est une
and
approche
perhaps Dr. Nu will
d'information,
want
de
to add something.
transparence.
Our
Toute
approach
l'information sur
is
les
an approach based on
évaluations
transparency and
des
information.
vaccins sont disponibles en ligne.
All of the
Je pense que
information
le
about
remède
assessing vaccines is
à
available online.
l'inquiétude et à l'hésitation par rapport au vaccin, c'est l'information.
I think when it
Puis c'est
comes
vraiment ça qu'on
to
veut faire, c'est mettre l'information de l'avant pour rassurer les gens. C'est sûr que
reassuring people,
des
it's
fois, des
all
cas
about
anecdotiques d'un
transparency
effet
and
indésirable
information.
lié à un produit de santé peuvent
Anecdotal
déclencher des
stories
inquiétudes. C'est
about
sûr qu'il faut
adverse
garder en
events from
tête
a health product
qu'actuellement,
can lead to
il y a un focus
concern and hesitancy
médiatique
among the
planétaire
population.
sur les effets
Right
indésirables des
now,
médicaments.
I would add
C'est sûr que
that there
quand on
is a
commence à
global media
penser que
focus
quelque
on
chose,
the side
qu'un
effects or
produit de
possible
santé
side
peut être lié à un
effects
effet
of
indésirable,
these
on
health
se met à faire
products.
toutes sortes de liens qu'on n'aurait
And
peut-être
of
pas fait
course,
si on n'avait pas
once you're
eu
concerned
ce
about
lien-là en tête
possible side
initialement.
effects,
Donc,
then you
tout
might
ça a
start
créé, je pense, beaucoup
then you might start
d'inquiétudes par
linking all
rapport
sorts of
au vaccin
other things
d'AstraZeneca.
to
Ce que je peux
taking that
vous dire, par
vaccine,
exemple, c'est qu'en
even though they're not
en
necessarily
Angleterre,
linked.
dans le Royaume-Uni, en
What I
fait,
can
11
say is that
millions de
in
doses
the
ont été
UK,
administrées
11
de
million
vaccins
doses of
d'AstraZeneca,
the
puis
AstraZeneca
un
vaccine have
grand
been
nombre aussi de
administered,
doses de Pfizer. Les
as
effets
well as a
indésirables
high number of
thromboemboliques
Pfizer
ne sont pas
doses.
différents entre Pfizer et AstraZeneca.
And
Alors,
there
il y
is
a
no
beaucoup
difference
d'inquiétudes
in
autour
the
du produit
amount of these
d'AstraZeneca.
adverse events
Il y a une
between Pfizer and
investigation actuellement en
AstraZeneca.
Europe sur peut-être
There
certains
is
types de cas un peu
currently
plus
a
rares, puis on va
European
voir, mais on
investigation
parle vraiment
happening on some
de cas
rarer cases.
extrêmement rares, mais
We're
actuellement,
talking
sur la
about
base des
extremely rare
informations
events, but right
disponibles,
now
je
what
pense
I
que c'est
would
important
say
de réitérer ce
is that on the
message-là.
basis of
Il n'y a
available
pas d'inquiétude
information,
spécifique liée à des risques
and I would repeat
thromboemboliques
this,
avec le
there
vaccin
is no specific
d'AstraZeneca.
concern
Comme le
about blood
docteur
clotting
Nou a dit,
adverse
il y a
events based
plusieurs
on the AstraZeneca
pays européens
vaccine.
qui ont pris une approche
As Dr. Nu
de
said,
prudence, peut-être
various European countries
en
have taken a
voulant rassurer
precautionary
leur
approach,
population,
perhaps to
puis en voulant
reassure the
s'appuyer sur
public,
l'évaluation de l'Agence européenne du médicament.
and while
Mais
waiting for
actuellement,
the
sur la base des
European
données
Medicines Agency's
colligées par
conclusions.
l'Agence européenne du médicament, il n'y a pas de nécessité d'avoir
But what I
d'inquiétude
would
par rapport
say is that
au
based on what
vaccin
we've seen so
d'AstraZeneca.
far,
Puis
there's no
si
reason to
Santé
be concerned
Canada
about the AstraZeneca vaccine.
obtient des informations ou puis on est en contact régulier avec l'Agence européenne du
We
médicament à
are
l'effet qu'il y a un
constantly in
risque
communication
particulier avec le
with the
vaccin
European
d'AstraZeneca. On
Medicines
va rapidement
Agency.
prendre
And if we do hear
des
that there's
actions
a specific
réglementaires,
risk
que ce
related
soit
to the
rajouter de
AstraZeneca vaccine,
l'information, aviser des
then we will immediately
Canadiens,
take action.
prendre des
We
mesures
will
nécessaires
advise
s'il y a
Canadians
quoi
and
que
we
ce
will take
soit
all
là,
necessary
qui devient
measures.
concluant au niveau du
If
profil
we
d'effet
do
indésirable. Mais
ultimately
actuellement,
get
l'information qu'on
information
a,
about adverse
puis c'est la
events,
position non seulement de Santé
but
Canada, mais de
so
l'Agence
far,
européenne du médicament, de
based on the
l'Organisation
position taken
mondiale de
by
la
Health
santé,
Canada, the
de
World Health
l'Agence
Organization, the
réglementaire du
European Medicines
Royaume-Uni,
Agency,
c'est
and the
que
UK's
les
regulatory
bénéfices des
body,
vaccins,
based on all of
incluant
this,
le vaccin
the
d'AstraZeneca,
benefits of the
l'emportent
vaccines,
grandement sur tout risque qui pourrait être
including the
associé au
AstraZeneca
produit.
vaccine, greatly outweigh any risks that could be associated with the product.
Merci. C'est Dr. New. Peut-être je peux ajouter quelque
This
chose
is Dr.
à
New.
la
I will
réponse
just
de
add
Dr.
something.
Berthiaume. Je pense que la chose la plus importante, c'est vraiment
I
de
would say
fournir aux
that the
Canadiens et
most important
Canadiennes
thing
comme dit,
is
l'information
to give
crédible et
appropriate and
fiable. Et je pense
credible,
que
reliable
les
information to
Canadiens,
Canadians.
en général, ont beaucoup de confiance dans leurs fournisseurs de soins de
Canadians
santé
tend to trust their
sur le
healthcare
terrain. Donc,
providers
je pense
that are on
que
the ground.
c'est quelque chose à faire parce qu'on a déjà
And I
commencé
think
avec
that's
une
very
série de
important.
webinaires
We've already
pour donner
started a
les
series of
outils,
webinars
la bonne
to
information
give people the
aux
right tools and
fournisseurs
information,
pour
or rather, to give
les donner
providers
la
the right
confiance
information
pour avoir des bonnes conversations avec le
and
patient pour fournir les
to
bonnes
enable them
informations.
to
Donc, je
give the
pense qu'au
patient
fur et à
the right
mesure,
information and have the
on
right
continue
conversations with
avec
them.
comme dit, les bonnes données probantes, aussi
I would
l'information
say
et
that we are
donner aussi des
continuing
webinaires,
to
des autres
base our
outils pour
decisions on
fournir
reliable data, and
les
we are also
travailleurs de la
setting up
santé avec
webinars
la bonne
to
information
give
pour avoir
healthcare
des bonnes
providers the right
discussions avec le
conversations so they can
patients
hold
pour
good
augmenter leur
conversations with their
confiance
patients in order to
avec les
increase
vaccins.
Canadians' trust in the vaccines.
Merci. Thank you. Prochaine question. Next question.
Merci. Our next question is from Ryan Tumulty from the National Post. Please go ahead. À vous la parole.
Yeah, this question is for Minister Champagne. Two of the big announcements that you're making today are in fill and finish facilities, which, while great, aren't really the whole vaccine manufacturing chain. Are you concerned that even with all these investments, we still don't really have a full manufacturing industry for vaccines in Canada?
Well, thank you for the question. Obviously, we'll continue to invest. You know that the mission we have put ourselves is to be more resilient. You know, we've invested in a number. I mean, you have to understand when we started that, and I want to give kudos to Dr. Tam and Dr. New and Dr. Bertillon, but there was like some 324 vaccine candidates or 200 something. They can be specific on that. We selected 7. And they were widely approved. I mean, the subset that we have, which have been approved in Canada, have been approved in a number of countries. Now, since day one, we have made sure that we would speed up our investments in biomanufacturing. You know, 12 days, I think the World Health Organization declared a pandemic was on March 11, if my memory serves me well. And within days, we had already invested close to 200 million. And within 30 days, we added another 600. So we already had 800 millions to invest, I would say, and to increase our domestic capacity. Now, what we found in Canada, and you probably saw that in different articles, is that the 2 sites where we had, which could do volumes, you know, to attract the big vaccine developers, you need volumes. So one is GSK in Quebec City, which is already doing the influenza vaccine. And you have Sanofi Pasteur, which is the former Connaught Laboratories, which is also doing polio and other type of vaccines for the world. So what I've been doing and what we've been doing as a government since day one, and trust me, I've been texting and talking to about all CEOs that I can find to make sure that we onshore as much of the critical components, whether it's adjuvants, whether it's lipids, whether it's fill and finish, to kind of plug the gap that we had in Canada. And the investments of today, I mean, it's 100 million. The total project value is 176 million in terms of project value. That's quite significant. I mean, if you just take CABs, which I mentioned, CABs will allow us to do on a speed fill and finish capacity about 30 million vials per year. And we're going to continue with Medicago. I had a chat with the CEO. We're trying to accelerate whatever could be accelerated in order to have them come to production as quickly as possible. And you know, Novavax, and with the Royal Mount facility, with the National Research Council, we're still on track to finish construction by the end of the summer. Then obviously we have commissioning and good manufacturing practices by Health Canada to be in a position to produce vaccine by the end of the year. So I would say we're firing on all cylinders to attract as many vaccine candidates which have been recognized to establish themselves in Canada. And one of the key components to do that, I would say, is the fill and finish capacity. And we're looking across the country. Now you've seen 3, but I can tell you we're at least talking to many more in all parts of the country to rebuild the ecosystem.
Yeah, and just as a follow-up, we've heard a lot from the pharmaceutical industry in Canada that beyond these investments, that the climate here is just not great for them, that from patent protection to their ability to sell to multiple, the drug prices are kept low because there's so few buyers, and some other issues around that. Are you looking at some of those structural problems, the patent protections, the tax changes, things like that, to maybe attract more of an industry here?
Thank you for that. Yes, I've heard some of that, but what I remind them is that the world is facing a health emergency. So what I'm saying is that I'm happy to engage in a long-term discussion with respect to some of the irritants. I mean, we said it. We're reversing a trend which started, in the 1980s. So obviously, what I'm saying to them is let's take strategic, immediate actions with a long-term vision, because that's what we need to do now, because not only I'm trying to attract them in Canada to be able to manufacture for our domestic needs, but I think Canada has demonstrated itself to be a very good partner. What I've heard from many CEOs, they say Canada is a safe bet. Stability, predictability, we didn't put export restrictions. You probably heard from Pfizer that if you look at the vaccine, there's more than 100 components coming from something like 40 or 45 suppliers coming from 19 countries. So obviously these companies are very keen that they can establish their presence in places which have been stable, predictable, and making sure there's no too much encumbrance on their supply chain. So I think because of the human capital, because of the investment in research, I think that what I'm saying to them is let's rebuild the ecosystem step by step. I hear you, and we should as a country and as a nation, but we can also at the same time take immediate strategic actions that will help to rebuild the ecosystem. And some of what you see this morning is that. And I can assure there'll be more to come because we are in discussions with a number of players in the industry. And like I said, what I hear is Canada is a safe bet. And that is encouraging for us and should be encouraging for Canadians.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. The next question is from Glenn McGregor from CTV News. Please go ahead. Your line is now open. La parole est à vous.
Got a question for Dr. Tam about the situation in Thunder Bay, Ontario. It now has the highest per capita number of cases booming there. And I'm just wondering, is public health monitoring that situation in Thunder Bay? And if so, do you have any insight into what's happening there and whether or not the province should take more action, declare it a hot zone, and respond accordingly?
Yes, I'm aware of the situation in Thunder Bay, and obviously as a provincial jurisdiction, and we can, from a public health agency perspective, can provide support which is generally more technical, but government-wide, there's of course federal supports can be provided, whether it's isolation sites or support for people who have to abide with the public health measures. And I think Ontario is taking a more regional approach to how they're managing their outbreaks and their epidemiologic situations, so that they are, obviously treating Thunder Bay, I think, differently to maybe other areas where there's less activity. I think the other sort of key message about what's happening in Thunder Bay is that one is, areas that were less affected in the past can easily become the next hotspot. So I think that's definitely something to be conscious of. The other thing is that there are a number of vulnerable settings in whether it's congregate living or shelters or other more vulnerable settings, which you got to give them as much support as possible because it actually has community impact as well. It's not just these viruses know no borders, and if it affects certain high risk and vulnerable groups, it's going to impact the rest of the community. So as much help as you can provide in that context, the better. And obviously with the vaccinations in Thunder Bay and elsewhere, that has got to sort of continue as fast as possible. But I don't have specific details as to what supports we may have already provided, but those are the general things that the federal government can help with. But yeah, I mean, I think at these, and any place could become a hotspot. And the key, again, is to act fast so that you can get out of that crisis situation fast.
Okay, thank you. Question for Minister Champagne. And Minister, I hope you won't mind me asking about your previous position. But when you were foreign minister, were there any efforts made to repatriate Canadian children in Syria? And wondering if Canada, should it be following the European Union's model more aggressively and directly trying to bring Canadian children back to Canada, especially if we're hearing reports there's one there who's only 2 years old. I just wondering what your thoughts on how actively the government was trying to do that when you were foreign minister, and whether or not that approach should be changed.
No, it's a fair question. I guess when you're a minister of the crown, whether you move around, and I did some of that, you've touched different things. I'm happy to answer your question, and obviously Minister Garneau could provide you the more updated. But certainly, you will remember that we repatriated an orphan. I mean, we said it at the time. These were exceptional circumstances. We had an orphan which we successfully brought back to Canada. We said at the time that one of the paramount, I would say, objective is to do that safely. As you know, we don't have a diplomatic presence in the region, or I'd say in that country, in Syria. So we have a duty of care to our own employees when it comes to providing consular assistance. In that particular case of the orphan, we mounted a very complex operation with the help of the local authorities. These circumstances were exceptional. Like I said, this was an orphan who was in a camp, and we were able to do that. And I think we said circumstances like that are very exceptional. And I would say, obviously, we are looking at ways how we can provide consular assistance to those Canadians who are there. But you would understand we need to balance that with our duty to protect the health and safety of our own consular officials. And we've said it, we could do it in that particular case because the circumstances were exceptional. And I think we have demonstrated compassion, and we will continue. And there's always ways where we're trying to support Canadians who might be still in Syria.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
Thank you. Merci. The next question is from Tom Parry from CBC News. Please go ahead. Your line is now open. Merci.
Hello. Thank you for taking my question. This is for Dr. Tam and Dr. New. This question was asked a little earlier on in the session.
Hi, Tom, we've lost you. I think the line has cut. I believe there is one last person on the line, so we will take the next question from a reporter. Operator.
Please go ahead, Mr. Parry. Your line is now open.
Hello, this is a question for Dr. New and Dr. Tam. I'm not sure if you can hear me. I'm trying to find out whether you think a third wave is underway in Ontario.
I think this is Theresa Tam. I think even the Ontario public health entities, the colleagues in the province have reflected on that. This is an inflection point, I think, for Ontario. After descending on the epidemic curve for that sort of second wave, if you like, haven't even got to the bottom of that second wave, obviously, that they could now be at the inflection point into a phase of resurgence. And that variants may well be playing a part in driving acceleration in the days to come. What actually happens thereafter, from this point on, then depends on the actions that are taken as to whether this is a little bump or whether things might take off. So you've probably heard their statistics on the fact that there may be 40% of the cases are now due to variants of concern with increased transmissibility. So I do think that this is a really, delicate point. And if the public health infrastructure, the testing, the tracing can't keep up with the acceleration, and particularly if there's an inkling of increased hospitalizations, then they will have to adjust their measures accordingly.
Yeah, it's Dr. New. Just to add to it, I think I answered the question in French as well, is that certainly, in terms of waves or wavelets, as Dr. Tam also alluded to, is that Ontario certainly seems to have a slight increase in cases. And so maybe it's an inflection point and maybe it's a little blip that'll go down. But certainly I think the important point to emphasize is that what Ontarians do now matters, because obviously we'll see the consequences, in a couple of weeks if the cases continue to rise, or if, let's say, hopefully the right measures are in place and people continue to follow public health practices, so that it just becomes a tiny blip in retrospect rather than obviously a continued increase. As I said, sometimes you don't know what wave you've had until maybe you're actually on the downside of the epidemic curve. So I think the point's taken. I think everyone's aware that the variants, especially in Ontario, are continuing to continue to become a greater proportion of the cases that are reported, and that's something I think that bears watching. And certainly, I think vaccination is as it unfolds is a good sign. But in the meantime, as we've stressed numerous times, people need to understand and appreciate that the following local public health measures and individual practices is key at the present time. Thanks.
When do you think we'll be able to say when and if we are in a third wave? And just in terms of the variants, I mean, how big a role? I mean, is that what's going to be driving a third wave if and when it comes?
Theresa Tam, I think they will play a key role as I said, in the Ontario context. You've seen the variants taking a bigger and bigger part of the pie chart, if you like, of what's happening in Ontario. They're now at 40% of the cases, and that could easily accelerate to 50% and beyond. So I do think with the B117 variant in particular, it's now become it's in over 100 countries. In the UK, it's like 99% of their cases. So that may well be the driving force. Not that the pre-existing circulating viruses won't play a role, but this is the accelerant to a potential for resurgence. And just to add that Ontario isn't alone. There are other areas of the country where we're beginning to see some, beginnings of an increase. At the same time as we're trying to get through the sort of March break, spring break periods, and sort of this is a period of concern as trying to ensure that the members of the public don't during these times of breaks is when we can see an acceleration of cases, because people have a natural tendency to try and congregate in larger numbers, and so it's not the right time to do that. And if everybody plays their part, we'll get through this next month as the vaccines are rolling out, and we'll be in a much better shape.
Merci. Ceci me fait la conférence de presse d'aujourd'hui. Thank you, everyone. This puts an end to today's press conference.
Merci, au revoir.